Welcome to Coronavirus The Rundown. I'm Chris Stewart. Each day we showcase how American communities are taking on the coronavirus and break down the headlines. Today, a new testing option. A new at-home test could help in the fight against coronavirus. The FDA granted LabCorp emergency approval for this test, where people swab themselves, then mail their samples in. Healthcare workers and first responders will get first access. They'll be available to the masses in a couple of weeks. The White House is finalizing an executive order to pause all immigration into the U.S. to help in the fight against coronavirus. It's expected to last several months. Critics say they don't believe the decision has anything to do with coronavirus. Your Amazon order may take a little longer to arrive. Hundreds of warehouse workers say they plan to call in sick this week. It's to pressure Amazon to improve workplace conditions. Separately, an Amazon employee group is planning a sick out for Friday. And some important news for people who get government benefits and have dependent children. Those Americans who aren't required to file tax returns need to enter the child's information on the IRS website by noon Wednesday. That's in order to receive the $500 credit for dependent children under 17. You'll enter the information on the special non-filer tool on the IRS website. It's a very short window, but this step is required. People who miss the deadline can still get the $500 credit when they file taxes next year. Small businesses are struggling to get loans under a program meant to help them stay afloat. Alicia Nieves is looking into why.
For the millions of small businesses struggling right now, Congress set aside roughly $350 billion to help them when it passed the CARES Act.
If we would not have received this PPP loan, every one of my staff, including myself, would be on unemployment right now.
The Treasury Department says 1.6 million businesses got on average $250,000 in forgivable loans under the Paycheck Protection Program. But a survey done by the National Small Business Association shows 52% of small businesses applied for the loans but did not get them. And part of the reason why is because some of the money intended for smaller businesses went to much larger companies and chains, like the steakhouse chain Ruth's Chris or the fast food restaurant chain Shake Shack.
It's extremely frustrating that huge corporations are receiving $10 million loans and smaller businesses didn't get any payout at all.
Shake Shack has announced it is returning the $10 million it got, but on a technicality, that money can't be redistributed to smaller businesses still in need.
A lot of banks, especially the bigger banks, serve their existing loan customers first.
Todd McCracken is with the NSBA.
A company that has an existing lending relationship or borrowing relationship from the business owner's perspective with a bank is probably a well-established business, probably a little bit larger business on average.
When Congress passed the Paycheck Protection Program under the CARES Act, it allowed banks to distribute the money in an effort to get that money out faster than the government could. But banks are now being criticized, some even sued, for possible preferential lending.
It was to be expected that a lot of this kind of thing was happening. I think it's different scenarios at different institutions.
In an effort to remedy this, Congress is trying to pass another bill that would give small businesses additional money. But those businesses are hoping this time that money comes with more and timely guidance.
I do think that finding a way to target the companies that were left out in this round would probably be helpful.
Without additional help, the NSBA survey shows nearly half of all small businesses are not confident about their financial future, and small businesses make up nearly half of the U.S. economy. I'm Alicia Nieves reporting.
Alicia, thank you. And the coronavirus death toll around the country has doubled in just a week. But that's not stopping some states from relaxing social distance restrictions. The state of Georgia plans to reopen gyms, bowling alleys, hair salons, and other businesses on Friday. Theaters and restaurants will reopen on Monday. Mayors around Georgia say the state simply is not ready for this.
I am beyond disturbed. In my mind, this is reckless.
We're simply not ready to reopen. Our hospital is still at capacity, and we certainly don't have the capacity to contact trace.
Other states in the South are following what Georgia is doing. Places like Tennessee, South Carolina, Texas. Then if you go out west, even Alaska, taking some of this as well. Now, however, none of those states have seen a 14-day decline in cases, which was one of the White House's suggested conditions for reopening. People and organizations are doing what they can to get on track towards some normalcy. We have partners at Newsy who spoke to a chef who's helping feed healthcare workers.
My name is Nicholas Mrnarevic. I am the co-owner and head chef of Bon Gusto Restaurant in Closter, New Jersey. One of the most important issues that we would like tackled here is feeding the healthcare professionals. I know personally at least 5 or 6 different nurses that I know, my cousin included, that they've been working for 3-4 days straight without any rest. So they need to eat to keep the energy up. Me and my 2 neighbors here, Zandigi and Mommy Eatery, we decided to start a campaign, and then about a week after that, it was up to about $16,000. And since we have fed 12 hospitals, roughly 630 meals combined, lunch and dinner. I've been making all pasta, mostly ravioli for the workers because it's easy to eat and it's not messy. Across the street, they've been making all of the chicken and rice dishes. And next door, they've been doing all of the soup dishes.
Hey guys, I'm here with my friend Bo at St. Joseph's. We're delivering all the food from Mommy and Bon Gusto and Zandigi. And super happy to be doing this. Thank you.
So far, the reaction from all the healthcare workers, the doctors, and the nurses have been overwhelmingly positive and grateful for what we've been doing for them. I've had police officers come by from all different towns to thank us, telling us that their mom or their girlfriends or their sisters or their wives are nurses or doctors. Everybody brings it up when they come to pick up takeout at night. It's the first thing that they say, thank you for helping the hospital. Yeah, as far as the other restaurants are concerned, I've never felt closer to my neighbors ever. Yeah, the goal here is that everyone is inspired by everything and everyone who's been helping so far. And this has been one of the most rewarding things I've ever done in my life. It just makes my soul feel better that I'm doing something positive with what I have to offer, and that's making food.
A community farm in Arizona is helping families get fresh food. Now, each family gets access to a plot where they can grow their own fresh foods. As long as families keep their distance, they are allowed to keep farming this summer. Now, David Encinas grows food for himself, his mother, and his grandmother, and he says it helps him relax and protects his family.
I have some carrots. We're growing tomatoes right now. We have a lot of cilantro, onions. We have some calendera. Right now, I'm looking forward to my watermelons. It's kind of preventing them from going to the store, and also me being able to supply them. And also to show especially my grandmother, show her what she's kind of taught me growing up, and know that it helped out a lot. A lot of natural stuff goes a long way. Makes you feel a lot better too.
Low-income families and those who live within 3 miles get priority. The community farm says families learn it doesn't take many resources to grow your own food. Now, on top of everything going on right now, many parents are dealing with hungry kids. We have some advice on what snack time should look like, and it can apply to adults as well. And everyone is spending more time in front of screens right now. The limits we should set, plus easy ways to follow those rules.
Keller and Keller, right now.
Oil prices are plunging, but so are jobs in the oil industry. The White House says it's drawing up a plan to prevent the loss of even more jobs. The BW Research Partnership shows that 9% of people in the gas industry lost their jobs in March. Other analysts predict that number could rise up to 30% in the first quarter of the year. Now, the Energy Department is also trying to help companies by paying them to stop oil production. Well, right now, a kid is asking for a snack somewhere, and John Rutter got some tips for parents that both adults and kids can use.
Kelly Lossick is a mother of 5 with a full house now that school is on hold. And like most parents, is faced with the challenge of feeding kids during the coronavirus pandemic.
Balance, I guess, is just trying to make sure they're getting the good stuff.
Health experts say the most important part and the most difficult is setting a schedule.
Kids usually do really well with the schedule, especially the younger kids, especially with so much uncertainty right now. Having a little bit of a expectation of what's going to happen throughout the day can be really helpful. So,
as far as what to offer up, it's best to pair up a protein with a fiber, something like an apple and peanut butter. But parents, be prepared to compromise.
Like, he likes a smoothie. I know he's not going to sip me a bowl of strawberries. Just kind of, hey, before you eat anything else, you got to make yourself a smoothie.
Since snacking and scrolling tend to go hand in hand, it's best to separate food and screen time.
So try as best you can to have maybe food take place in the kitchen or the dining room or wherever you do your meals, and then screen time is going to be separated from that.
And lastly, stay hydrated and make it fun. Incorporate a water challenge among the kids to give them an incentive to drink more.
Staying hydrated is going to help you feel good physically, stay well, and it's also going to potentially keep you from feeling as hungry. A lot of times if we're dehydrated, we feel hungry and our body's actually thirsty, so that's another tip to kind of work on for parents.
Now, an Arizona family is turning mask making into an educational activity. The Hendrickson family's security camera shows people coming up to check out some available options. They sew and iron the masks, and they learn different lessons along the way.
I've been sewing since first grade, and I'm in sixth grade now, so I've sewn a lot. We figured out that if we do different stations and each of us do a certain station, that it can go faster.
Now, the family lists the masks online when they're done, and they are free to anyone who needs it.
I think it's cool that we're able to make them and people are able to use them.
They've filled more than 400 requests. Masks come in different sizes and designs. Buyers and neighbors are donating elastics and cash to keep this operation running. Now, we are all spending so much time in front of screens these days. Children are as well. You think school being online, some of their after-school activities online as well. Socializing with friends and family, that's gone virtual. And that's on top of free time that kids already had in front of the screen. So should we be worried about that? Parenting experts at Bark say the rules on screen time now are a little more lax than they were before, but we should really still be mindful.
We also need to keep in mind that the screens are stimulating a part of their brain that is similar to the part of the brain that is stimulated with drugs or sugar. It's the addictive part of the brain. And so if you can limit it to about 2 hours at a time, that is ideal for helping to negate the negative aspects of it and then reap the positive benefits of it.
Sticking to a schedule is key. Make time for breakfast, school, and free time. Now, it's understandable children will be spending more time in front of a screen, but they should have breaks in between. Experts say they shouldn't be using a device for more than 2 consecutive hours.
Give them at least, a 10-minute to maybe even an hour of doing something else, and then they can come back to the screens for either school or personal use. But as long as you can stick to that 2-hour block, I think you'll be doing well by your children and yourselves.
One thing parents can try is setting a timer. You can assign an activity for that break, or at the very least, have the kids stand up and move around. With paper products becoming harder to find, a small business is helping out big time. Kai Beach shows us how they're helping fill a need and customers' hunger.
It's like a zombie apocalypse, and it's super dangerous outside.
A zombie apocalypse? Not yet. People in hazmat suits walking city streets? Definitely. This is the new norm for New York City. Empty streets and empty store shelves.
As women, it's hard for us to, go outside after it gets dark.
Anna Palterman and Marjorie Reyes live in the Lower East Side, where they say finding paper products gets more difficult each day.
It's the hardest thing to get. It's like trying to get, the hottest sneakers about 3 months ago.
And if you go into the local bodegas, they barely have anything.
Now these New Yorkers have new options.
You got the paper towels?
Yes, you got the paper
Yes,
towels.
Thank you.
It just cuts down how much you actually have to leave the house. So.
Ashwin Deshma is a partner at Williamsburg Pizza. He heard customers complaining and decided to start serving NYC rolls of TP.
People are freaked out. We thought it's like a nice, easy thing you can add onto your pizza order. You probably need some paper towels anyway when you're eating pizza. So.
For $1, customers get 1 roll of toilet paper. $2 gets them a roll of paper towels.
It's just about access. It's not really about, we're not going to get rich selling toilet paper.
Williamsburg Pizza was deemed an essential business and is now providing an essential service. Delivering warm slices and some much-needed paper products.
Paper towels as well?
Yes.
And the toilet paper?
Yay,
thank you so much.
So the next time Palterman and Reyes order a pizza as a main course, they'll ask for a couple side orders of toilet paper and paper towels.
It does make you feel, a little hopeful that,
things are going to get better soon.
I'm Kai Beach reporting.
Kai, thank you. Experts agree the U.S. needs to expand testing before the economy can fully reopen. We're with a company that is getting creative to help make that goal happen.
Visit theindychannel.com/rebound.
Welcome back. There's a big focus on expanding testing before the U.S. can reopen again. Chris Conti is with the company using a special tool to fill the need for testing equipment.
The impact it's had has been staggering.
For the better part of 3 decades, Dr. Richard Ellison has practiced medicine at UMass Memorial Medical Center near Boston.
I think what was a big surprise to us was that how much worse this actually was than we were really expecting it.
But as the man who oversees infectious diseases here, he has never experienced a time like this.
And this has been like compressing all of the first 10 years of the HIV epidemic into like a month. It's much, it's by far the most intense experience ever.
As we enter the next phase of this epidemic, and with a vaccine months or even a year away, what doctors around the country need right now is the ability to test more people.
We've been having to ration who we can do testing for.
That is where Gaurav Manchanda comes in.
It just shows how drastic the shortage is, or how severe that shortage is for everyone.
His company, Form Labs, shifted their focus essentially overnight. The company has dozens of 3D printers at their disposal. In the last few weeks, hospitals have been reaching out to them directly, begging for more COVID-19 test swabs. So they started printing, and they haven't stopped.
The fact that we have hospitals asking for these, even with limited trial data and limited lab testing available, it really does show how dire the situation is.
Instead of car parts or retainers, Form Labs is now printing out nearly 100,000 test swabs a day and selling them at cost. They're even giving away the instructions so hospitals can print the swabs themselves.
Understanding where we are at baseline and getting more test kits is really more test kits out there is the first step to understanding what we need to do to respond.
And until the epidemic is over, it's this kind of ingenuity that the nation will need to rebound. In Boston, I'm Chris Conti reporting. Chris, thank you. And a physical therapist is doing her part to make sure certain people aren't too lonely right now. The interaction that inspired her to make handmade cards for people living in nursing and assisted living homes.
Fuel are proud supporters of local literacy.
Welcome back to Coronavirus The Rundown. I'm Chris Stewart. And each day on this show, we end with stories to remind you of the good that is going on, even though it is such an anxious time. And today, it's a physical therapist from Virginia sending handwritten cards to people living in nursing and assisted living facilities. Now, Dr. Emily Wiesner was inspired by recent interactions that she had with patients.
I was helping one of them up to the chair, and I was just holding her hands because her hands were super cold. And she had said, this is the first personal touch or like physical touch I've had in weeks. And they both were just telling me their stories about how they miss their family and how, they don't get to do their regular activities. And they're basically confined to their room just to keep them safe.
Yeah, it is such a difficult time. Now, she said that she got to work with some help from her kids that day, and some friends and neighbors joined in, and they all made about 100 cards just within a couple of days. Now, if you want to do something like this, Dr. Wiesner says, reach out to homes and find out what they're accepting. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.